I am a proud native of Illinois, and I grew up and I still live on Chicago's South Side. I was raised by my wonderful parents, my dad who's a brilliant journeyman meat cutter and a self-made restaurant entrepreneur, and my mom is a nurturing and very decorated school teacher. I graduated from the University of Illinois in Champaign-Urbana in sociology and a love for biology. When I graduated, I worked in a local physician's office to gain experience, to beef up my medical school application, when I met someone who was from the industry who introduced me to the wonderful world of biopharmaceuticals. And so my career began as a rep on the south side of Chicago, supporting the same community that raised me. Well, I love my role at Genentech because I get to be a change agent and support the community who supported me for so many years. As the healthcare executive director for Chicago, my job is to manage our portfolio business and develop customer partnerships, but how I do it is what I love most. Well, when I found out I was selected for a Working for Cures champion, honestly, I had to read the email a few times before it even registered and was in disbelief. I guess I'm still pinching myself at this point. There are so many wonderful people who pour their hearts and souls into this mission every day, so to be recognized among them was such a beautiful surprise that leaves me feeling incredibly grateful and humble. Well, as we engage stakeholders and communities, it's important to say, first of all, anything we do is going to be with our communities and not at them. We honor every person's lived experience because there is meaning and value in every life and in every story. At our Genentech patient studio in South San Francisco, we have a patient quote posted on the wall to always remind us that inclusion is the only solution. And it says, if you do it without us, it's not about us. So we bring that same belief or ethos into all of our engagements when we're in the field. We've also engaged in some, I would like to say, non-traditional efforts to meet people exactly where they are, whether that's in a specific zip code or in their primary language. However, none of this work can be done in isolation, so partnerships are critical. Knowing that multiple sclerosis disproportionately impacts Black and Brown communities, we collaborated with one of our local societies to strategically place and host educational events within zip codes that over-index with these populations. We have an incredible STEM curriculum called Future Lab, which was developed to spark and maintain a lifelong love of the sciences. And through our local efforts, we've introduced this free of charge program to several high schools, as well as help field trips to congresses in partnership with high schools so these young minds can see what's possible, as well as meet researchers, scientists, providers who come from similar backgrounds and communities like they do. When we engage with elected officials on the local and federal levels, honestly, nowadays, those discussions can range quite a bit, really depending on the topic du jour. But I am fortunate to partner with a dynamic external affairs team who does quite a bit of the heavy lifting. However, beyond ensuring the right policies are in place to protect patient access and scientific innovation through joint advocacy work, and as a leader within our customer-facing team, I have the unique opportunity to elevate the voices of our community while also sharing our local efforts to address care gaps and improve health outcomes within the respective districts. And so these discussions with elected officials are about so much more than just policy. They are about people. For me, this work is deeply personal. I started my career journey in the same neighborhood that raised me, and I've experienced firsthand how access to care can change a family's trajectory. And my mission at Genentech is to ensure that for every family, the science is available, the access is ready, and the hope is real. We aren't just in the business of health, we are literally in the business for life. My name is Colleen Dodson-Honoré, and I work for Cures.